Social anxiety disorder, also known as social phobia, affects millions of people worldwide. It's more than just shyness or feeling nervous before a presentation. It's a persistent, intense fear of being watched and judged by others that can disrupt daily activities and make ordinary interactions extraordinarily difficult. Today, we'll explore what social anxiety disorder truly is, how it affects those who experience it, and most importantly, how it can be effectively managed and overcome. What is social anxiety disorder? Social anxiety disorder is a mental health condition characterized by an overwhelming fear of social situations. Unlike occasional nervousness, this disorder causes significant distress and impairment in various aspects of life: work, school, relationships, and daily routines. People with social anxiety disorder experience intense fear of being negatively evaluated, embarrassed, humiliated, rejected, or simply being the center of attention. Their minds become preoccupied with thoughts like, "Everyone will notice if I make a mistake. They'll think I'm boring or awkward, or I'll embarrass myself completely." It's important to understand that social anxiety disorder is not a character flaw or a sign of weakness. It's a recognized mental health condition that affects approximately 7% of adults in any given year, making it the third most common mental health disorder worldwide. Signs and symptoms. Social anxiety manifests through physical, emotional, and behavioral symptoms that can vary in intensity from person to person. Physical symptoms often include rapid heartbeat and palpitations, trembling or shaking, sweating and hot flashes, shortness of breath, nausea or stomach discomfort, dizziness or lightheadedness, muscle tension. Emotional and cognitive symptoms include intense fear of judgment, excessive self-consciousness, constant worry about upcoming social situations, rumination about past social interactions, fear of embarrassment or humiliation, negative self-talk and harsh self-criticism. Behaviorally, people with social anxiety may avoid social situations entirely, leave events early when anxiety becomes overwhelming, use alcohol or substances to manage anxiety in social settings, speak quietly or avoid speaking in groups, struggle to make eye contact, limit their participation in school, work, or community activities. Common triggering situations. While triggers vary from person to person, common situations that provoke social anxiety include public speaking or performing, meeting new people, being the center of attention, being watched while doing something, making phone calls, using public restrooms, eating or drinking in public, attending parties or social gatherings, job interviews, dating. For some, the anxiety is specific to certain situations, while others experience a more generalized form that affects nearly all social interactions. The impact on daily life. The effects of social anxiety disorder can be far-reaching. People may find themselves limiting their educational or career opportunities, experiencing difficulties forming and maintaining relationships, developing other mental health conditions like depression, experiencing reduced quality of life and life satisfaction, feeling isolated and lonely despite wanting connection, struggling with low self-esteem and negative self-perception. Social anxiety doesn't just affect major life events. It can make everyday interactions like ordering food, asking for directions, or participating in class discussions seem like insurmountable challenges. What causes social anxiety disorder? The development of social anxiety disorder typically involves a complex interplay of factors. Genetic predisposition. Having family members with anxiety disorders increases risk. Brain structure and function. Differences in amygdala activity and neurotransmitter regulation. Environment. Overprotective or critical parenting styles. Temperament. Inherent behavioral inhibition and sensitivity. Negative social experiences. Bullying, rejection, or public embarrassment. Cultural factors. Growing up in environments with rigid social expectations. No single factor causes social anxiety disorder, but understanding these contributing elements helps guide treatment approaches. Treatment options. The good news is that social anxiety disorder is highly treatable. Effective approaches include cognitive behavioral therapy, CBT, considered the gold standard treatment. CBT helps identify and challenge unhelpful thought patterns and gradually face feared situations through exposure therapy. Medication. Several medications can help manage symptoms, including selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, beta blockers for physical symptoms in specific situations, benzodiazepines, used cautiously due to dependence risk, mindfulness and relaxation techniques. Practices like deep breathing, progressive muscle relaxation, and mindfulness meditation can help manage physical symptoms. Group therapy. Practicing social skills in a supportive environment with others who share similar challenges. Lifestyle changes. Regular exercise, adequate sleep, limiting caffeine and alcohol, and maintaining a balanced diet can all help reduce anxiety symptoms. Most people benefit from a combination of approaches tailored to their specific needs and situation. Self-help strategies. While professional help is invaluable, there are many effective steps you can take on your own. Challenge negative thoughts. Question automatic negative assumptions. Is there evidence for this thought? What would you tell a friend in the same situation? Gradual exposure. Create a hierarchy of feared situations and gradually work your way through them, starting with the least anxiety-provoking. Practice social skills. Join clubs, volunteer organizations, or take classes where you can practice social interaction around shared interests. Focus outward. Rather than monitoring yourself, direct attention to the conversation or activity at hand. Practice self-compassion. Treat yourself with the same kindness you would offer a good friend facing similar struggles. Use relaxation techniques. Deep breathing, progressive muscle relaxation, and visualization can help manage physical symptoms in the moment. Prepare but don't rehearse. Having a few conversation starters can help, but over-rehearsing can increase anxiety and make interactions feel unnatural. When to seek professional help. Consider reaching out to a mental health professional if your anxiety significantly interferes with daily activities. You find yourself avoiding important opportunities. You're using alcohol or substances to manage social anxiety. You're experiencing depression or other mental health concerns. Self-help strategies haven't provided sufficient relief. Remember that seeking help is a sign of strength, not weakness. Many people find that even a few sessions with a therapist can provide valuable tools and perspectives. Conclusion. Social anxiety disorder may feel overwhelming, but it doesn't have to define your life. With understanding, appropriate treatment, and consistent practice of coping strategies, it's possible to manage symptoms and build a fulfilling social life on your own terms. If you're struggling with social anxiety, know that you're not alone and effective help is available. Small steps forward, even when difficult, can lead to significant improvements in your quality of life and social connections. The journey to overcoming social anxiety isn't about eliminating all nervousness. It's about developing the confidence to engage with life fully despite occasional discomfort. With time and support, what once seemed impossible can become manageable and eventually, even enjoyable.